special tests. So we're going to have a look at 3 tests from the front view here. The first one is called the Patella Tap. Now for the Patella Tap test, I'm just going to sweep my hand or push any excess fluid at all down into the knee joint, and I keep that hand there, and then with my other hand I'm just going to place my fingers on the patella and push the patella downwards. You're looking for excessive movement or a clunk or clicking or pain underneath the kneecap. So if there's any excess fluid, the patella would raise up and you would have a lot more movement there on your patella tap. I know the name sounds like you should be tapping the patella, but the tap comes from the patella hitting the femur underneath. Okay, so on mark, that's a normal amount of movement. Another test you can use to look for inflammation in the knee is the sweep effusion test. So for this one, we're going to drain up the medial edge of the patella. So I normally do 3 strokes, hold my hand at the top here, and with my other hand I'm going to go down the lateral edge. And what we're looking for here as a positive is a refill into this medial edge. So there's a negative test result because as I come down here, there's no movement, no refill at all, which for my client is good. For the video, doesn't really show much. So this time we're sweeping up the medial edge and hold the fluid at the top and then sweep down that lateral edge there, and you can see the refill occurring, which suggests there's some form of effusion in the knee joint. And the last one is Patella Maltracking. For this one, we're looking at the strength or weakness of the vasti group, so the vastus lateralis and medialis. I just use my thumbs lightly to draw a border along the patella and get my client to contract the quads and relax. And you're looking at how the patella moves. Now my thumbs are there just as a bit of a guideline. Will you just do that again for me? Okay, and relax. There's a slight shift of that patella outwards, which could suggest strong lateralis or weakness of the medialis. Now that can cause problems with any form of movement where the patella moves out of the groove slightly. So it could cause knee pain. So this is Noble's test for runner's knee or iliotibial band syndrome. For this one, we take the client into flexion. I'm going to find what I call the eyes of the knee, which is the indentation here into the knee joint line. I come around to the side and I go up about 2-3 centimetres. Now I'm pressing here. You can see movement of the IT as I press. Okay, so I just press and hold on the iliotibial band, and then I'm going to take the client into only about 20 to 30 degrees of flexion and extension. Now a positive would be pain underneath my thumb. Now it's quite a bit of pressure there anyway, so it will feel quite tender, but what we're looking for is that replication of the pain that they get when they're running, and it's irritation of the lateral femoral epicondyle rubbing on the edge of the iliotibial band. So positive would be pain, and negative is just tender because you're pressing. And then the last one we're going to do, if we get a client onto this side, if you face me, bring this knee up, that's it, excellent. I'm going to come around this side. I'm going to tuck the ankle underneath my armpit, hold onto the knee, push the hips so they're square on, and really I want a straight line from the knee, the hip and the shoulder. Okay, and then I'm just going to lower my right hand there to see how much drop I get of the femur. Okay, I don't want the client's hips to roll back or forward, so my hips there just to keep them level, and the knee is coming quite close to the couch, which is a good range. If they have tight ITB or TFL, you might take your hand off and find that the client's leg doesn't move from this position. So a horizontal position could show tightness in the ITB and the TFL.